Federal Parliament is sitting in Canberra and the health of one of its members is dominating debate. Labor MP Craig Thomson wants another week off work to recover from a stomach problem, but the opposition won't grant a pair for his vote without a better explanation of what ails him. And that stirred spirited argument in Canberra over the boundaries between health, privacy and politics. Stephen Jedgetts reports.
Parliament is back in Canberra, but one MP who's been in the spotlight is nowhere to be seen. Craig Thomson went to hospital last week, citing stomach pains.
Well, Craig Thomson is not well, and he has a medical certificate to excuse him for attending the Parliament.
Mr Thomson wants to miss Parliament this week too, while he gets further tests. But the opposition says his doctor's certificate is too vague. It wants more detailed information about his condition.
It says he's got abdominal pain. What is an abdominal pain? Is he got, I don't know, constipation or you don't know?
I simply note that Mr Thomson had appendicitis last August. Apparently he had appendicitis last Tuesday, and we'd like to know before we grant a pair that he has a genuine medical ongoing condition.
Government MPs have lined up to accuse the coalition of playing politics with Mr Thomson's health.
The coalition pursues a sick man, and disputes what his doctor's saying.
It has been a practice in this Parliament for as long as anyone can remember to grant pairs to people when they're sick. Mr Abbott doesn't have the decency, the grace to allow that to continue.
I don't believe we'd be having this debate today if it was Joel Fitzgibbon or Jill Hall or anyone else in the Labor caucus. This is about trying to put Craig Thomson back up in the public spotlight.
Doctors are bemused by calls for more information on the MP's condition. They say privacy is paramount with medical certificates.
All Australians are entitled to their privacy. All Australians are entitled to keep their medical conditions confidential. Certainly there are circumstances where employers might want to know more. But if that's the case, then it needs to be with the permission of the patient.
While Craig Thomson is the focus in the lower house, in the Senate, the government's on the brink of finally ushering its mining tax into law. A vote is due tonight, although the Greens are already pushing for the tax to be reviewed and increased.
I think this mining tax is way short of the mark. We'll be voting for it because the alternative is to raise nothing.
Given how much trouble the government's had getting this tax through, it's very unlikely to make any last-minute changes. Stephen Jedgetts, ABC News, Canberra.